My father lived with Parkinson's disease for over 17 years. He was diagnosed early, and in the early years, nobody had any idea. Over the years, things got more difficult. He had some physical limitations, and then cognitive limitations came in towards the end. And once he needed kind of someone keeping an eye on him and watching him, my mom wanted to keep him at home. She, with my push, brought in some caregivers to come into the home. And that's an adjustment, having people coming to your home, having consistency. I remember telling her, people want regular hours. If you want someone who's going to come the same person all the time, you kind of have to employ them full time. So it got to the point where the caregivers weren't enough. My dad was running away from the house, escaping, um, running to the neighbors, calling for help. And we realized this is taking a toll on my mom. And my dad even had started saying, is there someplace I can go? He had moments of alertness and awareness. Dementia with Parkinson's disease is very different than Alzheimer's dementia, looks very different. And there was a lot of awareness, not all the time, not when he was calling help. She's kidnapped me, but other times. And so in the middle of this, Don and I had moved. We were 45 minutes from them, and we'd moved further away because financial reasons. Basically, we moved and we wanted to not be as far from my parents, but it was not affordable for us to find a home without buying a teeny tiny home closer to where they lived. And so it became time. And I convinced my mom, let's look up near me. It's going to be a whole lot easier. And we, somewhere along the line, we found a company called Chaos to Calm there in the greater Charlotte area. There's other companies out there like this. So they provide, usually specific to seniors, but they coordinate services, things like decluttering, sorting and stuff, planning the space, seeing like when we found a place for my dad, knowing exact layout of the room and figuring out what pieces would go and what furniture would stay and things like that. They helped confirm with me, when we moved my dad, we wanted to keep it as close to his regular environment with familiar objects and that kind of thing. So they helped with sorting and packing. They hired movers that they vetted, and everything had to be cleared through them. So it really helped in the process. A lot of times they have a la carte kind of services, and you pay based on what you want. So finding that out early was helpful. And so I knew my dad needed memory care because he was trying to run away and escape. So my effort to locate places near us, looking back on it, I wish I had reached out to some of these people like we've interviewed that help finding places. But I wanted to go to the places myself. I wanted to ask the questions because I've worked in facilities. I've worked in memory care centers. I've worked in assisted livings, and I have a lot of understanding of them. But I'd recommend to anyone, even if you're a therapist like myself, to reach out for support from someone else. They might think of things that you don't, and it can be, it's challenging when it's your loved one, your parent. So we looked around. I found one that was highly rated near me for my dad. And so when you're going to an assisted living, they interview the person who's moving in. They want to know what their level of care is. They were able to do it over the phone for us over a Zoom call. We answered a whole lot of questions, and they talked to my dad. So with the memory care in an assisted living, they're partly determining, do you need the memory care that's a locked unit versus just the regular assisted living? So we kind of already had that answer to that question. So it was a process of going through, I had to go through these qualifications. You have to meet different medical requirements. Each state has different requirements like that. And so we got my dad moved in, and luckily there was another community with an active independent living community in the area for my mom. And we got my dad all settled, and we found this place for mom. It kind of worked out magically. And my knowledge of how communities run helped me identify that these, were good communities. And then my mom moved into independent living. And it's an adventure doing this. And I've worked in many different communities, and I see people don't understand the difference between independent living and assisted living and memory care and those types of things. And, even the best places, the care is not the same as hiring someone to come into your house. My dad was on a small unit and had good ratios of caregivers to patient, but they're caregivers. They're not all certified nursing assistants. They have multiple people they have to keep an eye on. And so, nothing beats that if you have a good person that you like one on one care, that all they worry about is your parent. We even had someone come in, even in the memory care unit, to be with my dad to assist him individually. And so knowing that despite how good places are, that there's still challenges and struggles and things we had to overcome. My mom got very frustrated with it, and we were very involved. We were there all the time, and um, what else do I say, Don? Um,
How about we start and then we can go into it even more?
I was grateful that the place we located him to was close to me so that we could visit him regularly, and that's what mattered most. So, hello, this is Gina.
And this is Don with Focus Healthy Family. And today we're talking, this is podcast number 231. And we're talking about the ABCs of senior living, really about their places and where
Senior housing.
senior housing. But as we start out, we've got a couple of jokes. And they're a little lengthy, but I think they're kind of good jokes. But let me pop them back up here and I can read them to you. So the first one is called Late Night Lecture. An elderly man driving erratically was stopped by a police around 2 a.m. and was asking where he was going at the time of night. The man replied, I'm on my way to a lecture about alcohol abuse and the effects it has on the human body, as well as smoking and staying out late. The officer then asked, Really? Who's giving a lecture at that time of night? The man replied, That would be my wife. Um, all right, the next one is just another kind of quick one here, a little lengthy, but good. Morris, an 82-year-old man, went to the doctor to get a physical. A few days later, the doctor saw Morris walking down the street with a gorgeous young lady on his arm. A couple of days later, the doctor spoke to Morris and said, You're really doing great, aren't you? Morris replied, Just doing what you said, doctor. Get a hot mama and be cheerful. The doctor said, I didn't say that. I said you got to get a heart murmur and be careful.
Um, Another one I was thinking of as you were telling that. I told my doctor that I broke my arm in three places, and my doctor said, "Stay out of those places." I get people all the time who say, "I broke my arm in three places," and it's
And you
hard.
just want to say
And
that.
it just goes through my mind, and I'm like giggling to myself. We have a
Ah,
tip for today.
yes, we do. Let me get my screen back over here. And today, our tip, of course, comes from Caregiver 101, The 101 Ways to Keep Caregiving from Making You Crazy by Mike Collins. We got to get him back on, too, by the way. Today, it's about being happy. According to President Abraham Lincoln, people are about as happy as they make their minds to be. Whether you want to believe it or not, the stress you feel comes not from the situation, but your reaction to it. Make a list of things that make you feel happy and commit to doing more of them whenever possible. It did.
So today I wanted to talk about the ABCs of senior housing. Kind of think about alphabet soup, right, Don? I say ALF, ILF. I even
I
texted you
know.
this morning, and you're like, "What's an ALF?"
Yeah, I know. I should
As
know
much
these
as
things
we've
at this
talked
point,
about
but
this, just realizing there's just misinformation, there's not a good understanding of differences. And, you know, and I see from behind the scenes part of the reasons that people get confused by it. So I
Well,
found a few different articles to kind of guide us along and kind of made an outline, Don, um, talking about senior housing.
well, if we want, I'll quickly go down the list and then we can kind of break it apart. And uh, I think you move from being your own couple, whatever, when you turn like 55, 60, a lot of times you get into what they call the 55 community, 55 plus, where it's really about just seniors and um,
There's requirements of
environment.
age
Yeah.
of living there. So yeah, these are just housing communities. They might have different amenities, but there's an age requirement.
And then you can move into a more independent living place, like where your mom's at right now.
Well, okay.
Okay. Then you go through it because you got it in your phone, don't you? Uh,
um, so just to touch on the different kinds of places that I want to talk about today.
this was your writing, by the way. Just
Yes. Independent living, abbreviated IL or ILF, assisted living, abbreviated AL, ALF. Then there's memory care, skilled nursing facility, what some people might call a nursing home. It's often abbreviated SNF. It's where short term rehab can happen, but long term care as well. Um, and then there's short term senior living. It kind of can look like respite care, but there can be many different aspects of it. So that's kind of the overview in general. And then I wanted to kind of get into more details about some of the differences as relate to liability, cost differences, services offered, medical care, and transportation.
well, I had a thought or going between a 55 plus community and independent living. I would think that one of the big reasons people would want to move from a 55 community to independent is they start losing some of their friends in the 55 community and they want to be in a place where there's activities where things are going on. Would that be
It
correct? And
might be a reason. The one thing is when you're in a facility, because there's the other thing I didn't touch on was a continuous care retirement communities, and that's where they have multiple levels of care. And so, in independent living, typically an apartment building, it's often a you pay one fee, services are covered. So it simplifies things versus living in a house where you have to take care of things. You got your electric bill, you've
yeah.
got your you're responsible. And like some communities, like my where my parents lived, they took care of the lawn maintenance. You know, if
Mhm.
you wanted to do anything with trees and shrubbery, you had to get approval for that. But
Yeah.
there's a lot of restrictions and requirements. But they did the upkeep of the yard. But you're basically living in a house and fully responsible, like living in a
Yeah.
house anywhere. Versus going into a community, it can simplify things. Making it easier to connect with people. Before, my mom had to go to people's homes. And when she was caring for my dad, it limited her ability to get out and do those things. So in independent living, you got neighbors, it's an apartment building. They're right there. You don't have to drive to go do things. So it's more convenient. So yeah, there's a lot of different reasons because there are in continuous care communities, like where my mom lives. I worked at one in Charlotte. They have independent living. They often might even have homes that are part of the independent living community. So you can literally purchase a house in the
Mhm.
community, independent living apartments that can be varied size and things, assisted living, memory care, and skilled nursing care. And the idea with these communities is if you needed different levels of care as you age and progress, the facility can provide it. A lot of these communities, there's a big buy-in. It's kind of like purchasing a home. There's a heavy cost up front, but once you're in the community, if something happens to you, they're going to make sure you're cared for, whatever level care
Mhm.
you need. And so yeah, it's just a whole different environment than just a 55 plus housing community. And that's, where I wanted to kind of talk about some of these big differences. Um,
I kind of look at this as steps. as you go through your aging life, again, you start at 55, you move to the
Could
independent,
be.
and then you might have to go to, I mean, they all varies, but it
Many people
does.
will live completely independently in their home until they die. Some people move to independent living facility and stay there until they die. I know when we moved dad into memory care, their goal was to keep him there and not have to move, even though it didn't have skilled nursing care. Their ideal was that you remain there and you don't have to change.
Mm,
Change is hard for any senior, but with dementia, it's even harder. So not necessarily steps because we all age differently and have different needs and,
yeah.
and, and things. Like for my mom, they do provide transportation locally to appointments and things. That can be helpful. Someone might be driving now, but maybe down the road they won't. There's a lot of different vision issues that
Mm,
can happen with aging, macular degeneration, glaucoma, that can affect your eyesight and safety in driving, but there's other factors that affect driving safety. And that could be a big thing, not, needing help with transportation. Um, so, I mean, senior housing, I kind of looked at this one article. Often just a senior housing environment in general means there's grab bars in the bathroom. Things might be more accessible. So, in 55 plus communities, a lot of the ones they're building now, they're flat entry. You don't have any steps to get in and out of it. Often one level homes, wider doorways, ability to have grab bars and things in the bathroom to make things more accessible. Um, so, that's kind of a big difference just in that aspect. And then I talked about the low maintenance lifestyle. So that's kind of a big difference between just living in a 55 plus community or a regular home versus going to a specific facility where, other people take care of the maintenance. At independent living, you're in an apartment. You're on your own like you would be in any apartment, but they offer meal services. It's kind of a one fee covers your electric, the water, even cable services sometimes. It's
mm,
sometimes it's all inclusive. Um, and so you don't have to, as far as budgeting, it's simple. I have, this much per month to pay for this facility. Having housekeeping services, laundry services, on-site maintenance, things like that can make that so much easier. Um, but in my own research and listening to some things, the big difference when you go from an independent living facility to assisted living facility, there's a big liability difference. If you move into independent living, it's called independent living. It's an apartment typically. Um, it sometimes could be, you know, kind of row houses, patio style homes close together or apartment. If it's called independent living, the person is responsible for anything that happens. It's like moving into an apartment.
mm,
At assisted living, the facility is responsible. So if someone falls, if
mm.
you're in independent living, it's you're you're responsible for everything. Um, or something else I was going to say. Um,
I'll try to fill in, but
so with independent living, it's governed by real estate laws. So if you go meet with someone at an independent living facility, it's like meeting with a realtor. They have apartments that they want to get filled. They're
mhm,
not going to interview and ask you what level of care you need. They're not going to touch on that at all. They have an apartment. This is what's available. This is what we have. This is why you want to live here. And there's no governing agencies about it. I kind of pulled up some information about, regulations with assisted living facilities because there are regulatory bodies that follow that. It's a state regulation versus a federal, so different states have different regulations for assisted living facilities. Independent living, none of that. It's real estate. You're purchasing or renting a
mhm,
space to stay, an apartment. They might have additional services and amenities, um, but in the end, you live there by yourself. If you don't get out of your apartment and go anywhere, no one's going to bother you because it's not a healthcare facility. It's not
mhm,
like there might be managers on site all the time, but it's it's like you're on your own in an apartment, even if there are additional services, if that makes sense, Don.
Yeah.
Okay. I
I'm,
I was going to let you ask me questions as we describe this. I run into this all the time. Places I've worked, people move people in, to assisted living because when you look at the bottom list of things there, Don, that talks about cost.
well, I guess what I look at right now is, and maybe we could talk a little bit about um, Medicare, and I'm on the Advantage thing versus and what kind of cost are any kind of cost in this involved with Medicare?
So in independent living, no,
Yeah.
no, you're getting an apartment. There is no government assistance of any sort. Um, if you have long-term care insurance, it might help pay for skilled nursing. Depending on the policy, it might help pay for assisted living. Once you're at assisted living level of care, there are places that will take Medicaid. If you qualify for that, that can, help pay for it. Independent living, no, nothing. So just to kind of keep that simple. And I think
I mean, you can be living in independent and have Medicare, but
anyone over 65 has Medicare.
it isn't covering the cost of the living.
Anyone over 65 has
Yeah, I
Medicare.
get it.
Medicare is about health. So Medicare is about health insurance.
Yeah.
It's health insurance, is what that is. So when you're looking at where you live, that's separate.
Yeah.
It's often completely separate cost. Um, again, unless you have long-term care insurance or you qualify for Medicaid or you have other medical services. So just to differentiate that, if that makes sense.
Yeah.
Um, so
So,
go ahead.
well, no, I was just gonna did we talk about the difference between the like cost difference between an independent and an assisted?
So yeah, I see because independent living is renting an apartment. Yeah, they may have different sizes. I've seen one that, they've got a studio apartments, they've got different size one bedrooms and two-bedroom apartments. So there's different costs involved. Where we're at outside of Charlotte, we're kind of in a more rural area. Costs can range from 2,800 a month to 4,000 a month. When you're talking assisted living, you tend to start at 35, 400, 4,000
Mhm.
because you are paying for on-site caregivers. There are people who
Mhm.
work for the company that are there on site. When you're talking assisted living, they have someone who administers medication. Often, this person's what's called a med tech. So it's not necessarily a nurse, but there's usually a nurse affiliated with the building, maybe not there all the time, but affiliated with the building. We looked at the place we found for my dad. There was a nurse who oversaw the memory care unit. She worked 5 days a week, typical hours, but she was not in the building all the time. There wasn't always a nurse in the building, and most of the caregivers were caregivers and not certified nursing assistants. That's a whole nother topic we could discuss. Um,
Well, within assist, let's go back. I want to make sure because we you kind of jumped up to memory care, but the assisted living, are they the cost? Do they have occupational therapists, physical therapists, and things like that? And do you pay for that separately, or is that?
therapy services are always a separate.
Okay.
Um, there's basically most people, they're looking at Medicare A, Medicare B. Um, Medicare A is hospitalization, therapy services, home health services. Medicare B covers your outpatient services. So that is separate as a whole. Skilled nursing facilities have nurses on staff, and that name, skilled nursing facility, tells the difference that there are skilled healthcare professionals that work for the facility. There's an administrator that runs it. There are nurses for each unit. There are often certified nursing assistants that work there. There might be other caregivers of types. But when people need that level of care, and a lot of those places have either their own or a company that does physical, occupational, speech, language therapy services. Again, it's billed differently, but they typically have that right there in house. Now, assisted living facilities, They're in between independent living and skilled nursing. They do provide medication assistance. Like I said, they might have a doctor affiliated with the facility, but he's not there all the time. Maybe once a week, but sometimes not that. And if there's therapy services there, it's an outside company that's renting space in that building. There could be companies that have their own therapy company there in the building. I did work for one. Um, but it's like going to outpatient therapy services. It just happens to be in your building. And independent living facilities can have this too. I work at one, and we are a separate therapy company. We rent space in the independent living building. We rent an apartment, and it's our therapy space. And we provide therapy services, and we operate out of the building. So we get to know the people that live there because we're right there on site. Um, Other places that don't have this, they utilize home health services when people need therapy services, and that's a separate agency coming out. You know, all of this requires doctor's orders to have therapy services, but they're just coming out to see the particular people that they have to see in that building. Versus if you're looking for a place, whether it's independent or assisted living for a loved one, if they have an on-site therapy company is affiliated with them and working at the building, it's a whole different level of therapy because those therapists are in the building. They can get to know the residents. They can walk down the hall and someone falls. They're like right there involved in finding out, reaching out to doctors. Does this person need therapy services? Versus if there's not an in-house, there's not a therapy company working in the facility, you know, there's not someone kind of keeping an extra eye on you. So there are independent livings that look so similar to assisted livings, but there's those key factors that people don't realize. Um, you know, Someone falls down in their apartment, in assisted living, they're going to be checking on you because if you don't go to meals, they're going to come get you. In
Hmm.
independent living, no, you don't. If you're sick, you can have meals brought to you, but you kind of have to ask for that, and there are independent livings that kind of keep an eye on people and might check on people, but again, it's regulated like real estate. There's,
Hmm.
the people who manage them usually have no healthcare background at all. They're getting paid to oversee things. They might, have accommodations of living there. Some places, the managers live in the building, but there's no responsibility on their part. It's just like living in an apartment, but you have the added benefit of they provide meals. Some do a la carte, some do 3 meals a day. They typically have a maintenance person that works in the building. So you're having maintenance issues, you can get help through the building where you live. Housekeeping services.
So we're talking about assisted living, and we talked a little bit. You mentioned that there's a difference between independent and assisted living as far as liability. What are the differences? Is there differences between assisted living and memory care as far as liability goes?
Well, so first let's look at skilled nursing versus assisted living. So skilled nursing is a medical facility, and so there's different regulations for that. Assisted living kind of in the early part of my career in the mid 90s, it was, kind of coming into play. It was kind of a whole new thing, at least in North Carolina. And I didn't look up the history of it, but it was kind of this new avenue of having a little bit extra assistance for people, but that don't need full skilled nursing care, don't need to have a nurse on site, 24/7 overseeing care. Um, um, and so it was kind of this new thing that crept up. And the places looked more like apartment buildings. It didn't have that feel of, people think of nursing home, think of the old style nursing homes and what they used to look like and possibly smell like. And they are building places that look much more modern now, but typically assisted living looks a whole lot more like an apartment building
Hmm.
complex versus a nursing home. And so there are, big differences. They're regulated totally different. But back to the assisted living, they are regulated. I looked up National Center for Assisted Living. Um, You can go to that website, and each state has separate regulations. I know we looked at this, Don, when your mom was needing assisted living, and we're here in North Carolina and we're finding out things from your family. And I'm like, oh, is different laws than North Carolina has, different regulations. And so I pulled up North Carolina's regulations. It's like 10 pages. And Georgia, their regulations, and they define things differently. North Carolina defines assisted living residents, and they talk about adult care homes versus multi-unit assisted housing with services. And in Georgia, they call places personal care homes versus assisted living communities. And so they have different laws, different regulations. Georgia specifies that something has a memory care service, there's additional requirements that have to be met. So they're regulated differently per state.
Um,
And so it can look very different from one state to another. So it's important to know what the regulations are in your state, in your area. So memory care units can exist in a skilled nursing facility and they can exist in an assisted living facility. Generally, they're locked units for people who are at risk for wandering,
yeah.
from wandering out of the building, heading down the road. I've heard those stories. Um, Wandering
Yep.
and getting lost, getting hurt. Um, so they're
That
more,
was my mom that, she escaped the building and got hurt, you know.
um, so they're generally locked units. Closer supervision, keeping an eye on these people a little bit more easily. And there's so many different styles of memory care. My favorite, I worked in some where you have a nursing station in the center, you have the dining in the center, it's all open, and then there are rooms going around. So
Huh.
you literally, the staff that's there can see everyone coming in and out of their room. They've got the TV area. Those are my favorite for someone who
Hmm.
really needs that memory care with significant advancing dementia. And if you want someone to really be keeping an eye on you, it doesn't guarantee your loved one's not going to fall because, the ratio could be 8 to 1 or 12 to 1 as far as staff to residents or patients.
Well, and it depends on where they are in the room too. They could fall in the room and not be seen, you
Yeah.
know.
But
So
those are my favorite kind of communities
yeah.
because, I mean, where my dad lived, it was just one long hall. It wasn't quite that set up, but I like that it was, and there's pros and cons to smaller versus larger. Larger has more activities and more things going on. Someone might feel trapped in a small unit. I worked at a place in Charlotte. They had a whole memory care building. There were 4 different units, so they could lock down each one separately. The whole thing was locked down. They had a common area in the center where they did activities. They had a chapel area, so people could, when they opened the doors, people could walk about. People who had more freedom, didn't feel so trapped that they could walk. I had a couple. She lived on one unit, he lived on another, and our therapy one time was we walked to go visit the wife on the other unit. Um, so yeah, there's just many different types, and there's different regulations that follow it. So different costs depending on if it's there's a facility here that has a memory care unit, and some of the beds are skilled nursing beds and some are assisted living beds. So that has more to do with payment, reimbursement. Yeah, there's different regulations behind it, but the people generally get the same level of care, which is kind of interesting. But that comes into where long-term care insurance might be paying for something versus um, yeah, that gets more into complexities of the medical care. But generally, yeah, someone with dementia and yeah, I know the idea, like the memory care my dad lived at, the idea was to stay there. And I've worked in buildings where their memory care is so small, and because they have assisted living beds, if someone's no longer a flight risk, they might move them off the memory care unit, which to me is not ideal. Um,
Yeah, I was gonna say, and once you lose the memory, it isn't like I wouldn't think it would. I don't know. That just seems kind
I
of
mean, with
odd
some,
to let them
Alzheimer's
out.
can advance to where you're not moving around anymore,
Yeah,
and you're just in
yeah,
bed or in a wheelchair, and but
yeah.
at the same time, it's still a change to that person. It's still a change in environment, a change in staff. So ideally, I think most memory cares like to be kind of as long as you meet these criteria. Like for my dad, as long as he didn't need it can only be transfer assistance of one person. If you need two people to help transfer him, get him from bed to chair, etc., then that no longer qualifies as assisted living memory care. Different levels of services. My dad had a catheter, urinary catheter in the end, and it was kind of a struggle of can he stay here as far as managing
Mm.
it. There were things they could do and things that they couldn't. I was frustrated because they weren't threading it through his pant leg right. They were
It
threading it.
was a mess. Yeah.
But again, they're not set up for dealing with those more medical kind of issues.
Well, let's talk about we talked about what it would cost to go from independent to assisted, kind of the cost of it. What about going in memory care and then skilled nursing? I'm sure is a little higher than what it'd be assisted living.
Oh yeah,
Okay.
yeah. Yeah, memory care costs a lot more than assisted living because you're getting that specialized
Yeah.
care. Some places have special training for their memory care people. Different states have different regulations. So I know, where my dad was at, the base cost was, I can't remember exactly.
Wasn't it around 5 or 6 thousand?
Yeah.
And
And
then
that,
it
and it
bumped up
goes
to
up
like
from there.
seven
And
at
assisted
certain point.
livings are like that because assisted livings can provide assistance with dressing, bathing, going to the bathroom, even
Mm.
eating. Independent living, if you want any services like that, you are paying for it separately.
Yeah.
You are hiring someone just like if you live in your home. But in assisted living, they do have the ability to provide assistance. Now, again, one person for how many rooms? So it's not the same as as being in your home or being in independent living and paying for a caregiver that comes to take care of you, right?
Yeah.
They're overseeing multiple people. But there's different levels. So assisted living could cost you depending. I know my dad at one point needed more help and they bumped up the cost because it was a higher level of care. They have criteria that fit into that. Some people need help. Some people in assisted living, they can't administer their own medication. And maybe that's the only reason they're there. They can walk, they can get around, they can
Mm.
get dressed, they can even safely shower by themselves. They may or may not even use a walker or cane, some, walk without anything. But some people might need help with a shower once a week or twice a week. Some people might need help getting dressed every day. They might need help getting in and out of bed. So those different levels affect the cost. Again, independent living, there's none of that. There's no caregivers. And if there are caregivers in the building, it's a separate company. There are places that hire that have, like I talk about where I work, we are a therapy company that operates in the space of the independent living building. There are independent living buildings that have caregiver agencies that operate within it. Just like you have beauty salon services that might operate in an independent living. They don't work for this independent living facility. They're a separate entity. They pay rent, they come in, they provide services. Same with the caregiver agencies, same with therapy companies. They're separate agencies. Um, People ask me questions all the time about the building I work at. I'm like, I don't work for the building. I know a little bit, but I don't work directly for them. I
Mm.
work and that's hard for people to understand because I'm there, 4 or 5 days a week. I'm in the building. I'm there all the time. What does that look like? So the lines get blurred because of these different services that can be. And those are things to ask if you're looking for a loved one. If you're looking at independent living, you know, is there a therapy company that operates out of the building, that's there on site? What other amenities are there on site? Some will give you like a call pendant button. Um, but again, what is that? You're still responsible for it. And
Yeah.
what like I think where I worked, I learned it's a press button that you can call. If you want to pay additionally, if it hits the ground, then it calls 911 automatically, or it calls an agency that then can call 911. But again, it's a separate service, like getting a lifeline at home
Mm.
versus in assisted living, you have a call button you press or pull to get someone in the building to help you. So it's very different. And I run into this challenge. Residents independent living sometimes have to go to the hospital and sometimes they need short term rehab and they go to what we call a skilled nursing facility for short term rehab. And then they come back to their independent living. and they're pressing their pendant like it's a call button, like someone's going to help them go to the bathroom. And it's not, it's an emergency response button. And when you're dealing with even mild dementia, these people don't even fully understand it. One
Yeah.
woman, she's a retired nurse, and there's no nurses in this building. No, there are no nurses that are in the independent living building. There are nurses who come in and out of here that work for home health agencies, but there is no one employed in the building. There is not. There's not a doctor that oversees the building. And so it gets confusing because things can look similar. But again, independent living, it's an apartment. They're going to selling you a space. They're not thinking about what level of care your loved one needs. They are wanting to sell you an apartment. And this is where it can be helpful to have an outside independent person who's not affiliated with a facility to help you with navigating this.
Yeah.
Because assisted living, skilled nursing, they will evaluate your needs and go through those levels and things with you. Independent living, no, you're renting an apartment. I can't say that enough times because I have people, both their family and the residents that live there, who don't fully understand this and can be more confused because of the additional services that operate out of the building.
Yeah.
But realizing that, we had a resident shortly after I started working there that had not been paying her rent. And the managers and the company that oversees the building, it's part of a large corporation, was being lenient with her. And she's getting behind and behind in her rent. And they gave her notices, just like you do if you're living in an apartment. And they actually got to the point where they had to evict her. She was way like, I think years past her rent. I don't know
Mm.
what the level of time, but it was a long time. They had given extra leniency than you would even get, but they actually had to call the police
Yeah.
to evict her because she was not paying her rent. And it was kind of like a weird situation. Like, this is weird.
Yeah. Well, yeah,
And
because
they so did not want to do this. They didn't want to have to evict her. But if you don't pay your rent, you can't live
yeah.
there. It was an interesting situation. She complained she was having heart failure, or whatever. So they called,
It's a,
because she wouldn't go with the police. They called an ambulance, emergency medical services. And so they took her, and obviously she never came back to live in the building. But
mm.
that's a whole nother avenue for
Well, let's
social services.
let's talk a little bit of, you mentioned about low income options. Let's talk a little bit about that.
Um, so that's a little bit more challenging. I was
Yeah.
I was researching lower income options because a lot of these places are costly. Um, and depending on what part of the country you're in, the northeastern part of the country, it can be more expensive. I know we're in
Hmm.
kind of a couple counties outside of Charlotte, North Carolina. It's a little more expensive in Charlotte, depend the areas of town or whatever. But there's still a big cost to this, and there are low income senior housing that's usually apartments for seniors, and it may or may not have, any extra components. It might just be an apartment that's lower income and specified to seniors. There are places that take Medicaid as far as assisted living facilities. Um, they might look a little different. I've worked in some that take Medicaid patients, and they're not as fancy. They're a little simpler because Medicaid is paying, but it's not reimbursing them at the same rate as you would,
Mm.
charge somebody for it. So it operates differently. That's the ones I've seen, at least. It might not be true everywhere. So finding out, are there places that accept Medicaid? And Medicaid is qualifying for it. Your income has to be very low. And again, state by state, it's different. And there's criteria for it. So someone might not qualify for it now, but down the road they might. Their resources get exhausted. So that's where it's really helpful to have a senior financial a financial planner who deals with senior care and to help with those aspects of the resources and understanding how that operates and how that works, because that can be a challenge. So um, independent living costs less. So I see this places I've worked, and people are like, oh, well, I looked at the assisted living and it costs this much, but this place, and this place has therapy services too, and they have a caregiver agency over here too. Well, I'm gonna let mom live here because this is more affordable. And I've worked somewhere, the daughter's even a physical therapist and knows. they really would benefit from assisted living, but mom just can't afford that. And, so they're living in independent living. I was listening to a podcast that talks about the difference and reading some of these articles. Independent living is designed for people who can bathe themselves, dress themselves, take care of themselves, can administer their own medication, and they can get about, whether it's in a wheelchair with a walker or without. They can get around themselves. So that's ideally what it was planned for. But there are people whose family members come and assist people who live in independent living. They hire caregivers that come and help with medicine management and other things like that. Um, and I had a resident, sweet lady, her dementia was increasing and she was struggling more. And the caregiver agency that operates out of the building, and that the nice thing about that is if you pay for a caregiver, you might have to pay for a minimum of 4 hours. There's different requirements, right? With caregiver agency, whether they come to your home or they come to where your person is living. Don, that's distracting. He's playing with something. Um, a caregiver agency that operates out of a building might be able to provide services at smaller increments of time because they operate out of the building. So, a place where I've worked, you can pay for 15-minute increments of time. Someone who maybe takes care of themselves but needs help with medicine, you can pay for 15 minutes twice a day just to come and help with the medication, or 15 minutes in the morning to make sure they get their clothes out to get dressed, or a half hour, and those kinds of things. So there's kind of these a la carte things. Again, these are all separate services. It's a separate company that's paid for, but can provide that help. So these are kinds of questions that it's important to find out and ask about. So I had this resident and they had caregiver services for her for showers. Well, then she needed more care. So they were having caregivers come in the morning and the evening for getting ready and things. And and the daughter was trying to decide, should she go to assisted living? And she had a cat, so she wanted to make sure her cat could stay with her. And that's something else. Pets
Mm.
may or may not be allowed in any of these places. But finding that out is another important question. Um, and they really wanted her to age in place. She's in her 90s, I think, or close to 90, wanted to stay there if possible. And I was encouraging, yeah, if you can pay for the caregiver services to come. She wound up moving her to assisted living. And I was concerned. She kind of made the decision. I didn't know about it till afterwards, because paying for a caregiver, they're coming in the morning between 7 and 8, and they're there to take care of you. When you go to assisted living, you're on a hall, 20 other people, one or two caregivers to help you out. So it looks different.
Mhm.
And just, I guess I'm just trying to explain it in a way to help people understand, because I see that the water is muddied. There's so many different types of facilities that offer different things. I also know that independent living don't give the full picture, and they're not required to. They are not a healthcare agency. They aren't governed by regulations like that. They are renting you an apartment. And yeah, maybe they serve meals and they have meetings and different services like that, but they're renting an
That does.
apartment. And so they follow regulations just like, real estate agencies would, and apartment buildings and that kind of thing. So that doesn't get spelled out to people. They want to trump up what they have. They want to, we have these services, and, our therapy company, works here, and we have these other services that operate here. And so, some people have extra care and things, but they
So,
don't understand, well, why would I go live here? This place is cheaper. Well, this place has on-site, nursing care. They have a call button that you press and someone can
um,
check on you. Um,
so it's really about persons that are looking at this for their aging loved ones needs to ask a lot of questions,
you
really needs to
do,
dig
you
in,
do.
because we could talk for probably the rest of the night talking about all the different
I couldn't,
facilities of it.
and I didn't even touch on continuous care retirement communities. So those, because you don't know, you might think, oh, my mom is, 85 and living in all, this whole time, but her house is too much for her. You don't know what could change. You don't know,
Mm.
she could suddenly need a higher level of care. And so, when there's multiple levels of care that can be offered at that facility. Now, it typically you're going to move to a different apartment. So you're not going to get to stay in the same place, but the community will provide services for you. One little story. So where my mom lives, it's a continuous care community, and they have a dining room for the independent living people. They assisted living has separate dining, but they can eat in independent living's dining. But when people go in to eat, if they have a walker, the staff parks the walker and brings it back to them. And I think the difference here is goes back to liability. Because they're a continuous care community, they're operating more like a medical community than a regular independent living. Where I work, the staff will not move people's walkers. There's issues with people parking them next to their table and other people tripping on them. Um, but if they park it on the wall, not everybody can safely get from the wall to their chair.
Mm.
And I've asked, why won't the staff do that? But I think it's a liability.
Mm.
They don't want to be liable for moving people's walkers. Just little things like that you might not think about that can really be a big deal. If someone uses a walker to get around safely, they might not be safe walking without it, and how do you get to a dining table and sit down and how do you manage that, right? There's all these different small components. I worked with a lady who broke her hand and she used to go to the dining room once a week, and now it was her dominant hand, and her niece is her primary power of primary care, whatever, responsible party. Why doesn't she get to the dining room? Why isn't she eating there again? Well, she has to be able to open her door, get in and out of her door safely, and get
Mm.
down there, right? And these doors swing closed, and she's got a splint on her hand, and she's not supposed to push and use that hand, right? So there's like different factors that come into play. And again, if you're independent living, if you're in assisted living, they would bring the meal to you. They would help you get there, right? There's a big difference. I have another resident who complains about the assisted living she lived in, but liked that you had assigned seating. Like that if you didn't go to meals, they would come get you and bring you. Like that they would knock on your door and tell you about activities going on. Versus independent living, they're not going to knock on your door and tell you an activity's going on. They had transportation services at assisted living with the wheelchair accessible transport. So the ramp comes down, your wheelchair goes on it so that you don't, because otherwise you have to climb steps. Independent living doesn't have that. We don't have a wheelchair ramp accessible transport van. We have a regular transport van. So this woman can't stand well enough to walk up steps. Therefore, so she's complaining about she was paying for all these services at assisted living, but well, here, they don't do that. They don't check on me for meals. They don't check on me for activities, and I can't get on the van. Well, you're not paying for assisted living anymore. You're paying for independent living. And so there are specific differences that you can look at. So there's just so many questions you need to ask when looking at these things, seeing the big picture of it, what long term, what could happen, what's this going to look like, what other services are available, what can the cost vary look like. People can move into independent living and maybe they move into a one bedroom, but their finances are getting tight. Well, they might have a studio and they might be able to downsize. Or the reverse, there's no two bedrooms available. Well, you move into a one bedroom now. And typically, when you live somewhere, you're the first on the list to move up to another apartment versus people coming in from the outside. So there's options like that. But I could talk about this endlessly, as you can tell. Um, I want to put together some resources on this because there are so many. I didn't even touch on respite care. We'll have to make a whole podcast out of respite care. Um, just to touch base, not only could you provide temporary care for a loved one, um, but you yourself can go stay at some independent living buildings for a week, a month, overnight, get to eat a meal there to see what it's like before making a full commitment to living somewhere. So something else to check out. So
When they may want to check into our podcast, we interviewed somebody that does the
co-housing.
co-housing.
Yeah, we need to link together all these podcasts with
Yeah.
similar information. We'll put it together in the description because, yeah, we've interviewed people that talked about these different topics in different details. But
Yeah.
I just kind of wanted to really spell some things out today because I see this confusion all the time. I know things are not explained to people, and there's reasons why, and just helping people to understand that better. Um, so thank you for joining us with our podcast today at Focused Healthy Family. If today's conversation helped you, or you know somebody who might benefit from it, please like, subscribe, and share this podcast with anyone. If stress, panic, or overwhelm are becoming part of your daily routine, consider Don's EFT Discovery Series. EFT tapping can be described as weird, but wait, this really works. People might start out skeptical, but after a few sessions, discover the benefits of this. For wellness, tips, caregiving resources, and more episodes, visit us at focusedhealthyfamily.com or focusedhealthyfamilypodcast.com. You can connect with us on social media. We're at Facebook, Instagram, Focused Healthy Family 1. We are on YouTube at Focused Healthy Family. You can listen to us anywhere you listen to a podcast and listen and or watch us on YouTube. New episodes of Focused Healthy Family are released every Thursday. Don is available to speak to organizations, caregiver groups, healthcare teams, and community groups about practical ways to reduce stress and build resilience in caregiving environments. For information about booking Don to speak at your location, please reach out to schedule a presentation or a workshop. And remember, how you speak to your children and your loved ones today shapes their future and yours.